Dr. Amanda Moore at Lone Star Animal Hospital, and I wanted to talk to you today about some of the questions that we get about spaying and neutering your pet. So my assistant Maddie's going to ask me a few of our more common questions, and hopefully this helps.
Dr. Moore, what is the difference between dog spaying and neutering?
So typically spaying refers to a female when we do a surgical sterilization, and neutering refers to male. Of course, you could use them interchangeably, and you'd be just fine.
How soon should I bring my pet in to see a veterinarian to get my dog spayed or neutered?
So typically we'll start talking about it through your puppy visits as you're getting puppy vaccines and things like that. We more commonly will talk seriously about it at the 4 to 6 month age range. Doesn't necessarily mean we're going to spay or neuter at that age range, though that is an acceptable time for some dogs. I think it very much depends on your dog's age, breed, size. There's a lot of factors that will go into making that decision, so your vet will make the best decision for you and your puppy.
What are some possible conditions that can be helped by spaying or neutering my dog?
There are definitely some behavioral conditions that if you're seeing them, it's time to start thinking about spaying or neutering if it's not been done already. Things like urine marking in the house especially, some dominance related behaviors, digging out from under the fence and roaming can certainly be a problem as well. There's some medical conditions too that we see a lot of benefit in spaying and neutering, especially in female dogs. If we can spay them before their first heat, we're much less likely to have incidence of mammary cancer. So all things to talk about with your vet, the benefits of the timing of that.
How long will it take for my dog to recover from being spayed or neutered?
So we'll typically recommend exercise restrictions for 10 to 14 days, just short leash walks to go potty, and that's it, no other exercise particularly. So that is something to plan for.
What care should I be prepared to provide at home while my dog is recovering from their spay or neuter surgery?
Okay, so with that exercise restriction, oftentimes puppies are just going 100 miles an hour, so we will send home, or at least offer to send home, some oral sedation that you can give to kind of help take the edge off and keep them kind of quiet and still. You'll want a small reduced area where they can't go roam through the whole house, jump on furniture, that kind of thing. So maybe a small room like a bathroom or a laundry room, or maybe utilize a series of baby gates so that you've got a small confined area that's a safe place for them. So I think that's it. Any other questions that you've got about spaying or neutering, of course, we'd be happy to help. Please just give us a call.